The reason we're here today is to talk about a recent complaint that was issued by the National Labor Relations Board against the hospital. A complaint can actually be used interchangeably with the term indictment. So basically what happened is a little while ago, the hospital shut down services and clinics at the hospital and laid off many workers. The hospital has also indicated that they have intention of doing more laying off and more services shutting down. And what happened is they shut down these clinics and then they outsourced it to a shell corporation that they own. So they're basically outsourcing to themselves. The labor board ruled that this is not acceptable and that the trial will be set for October 21st.
Essentially what the hospital is doing is they're diverting care from the hospital setting into a clinic-based setting for patients. That's going to be important for our patients because they're not going to have the access to the care that they're used to getting. Things like the bus line become important, and when these clinics are in the outlying areas of the City of New London and other places, it's getting to be more and more impossible for our patients to get there. And we're concerned about the quality of care that's going to be given to the patients. They're essentially going to get treatment from less experienced people.
Basically, this is a plot to save money at the expense of patient care, and it's sad. It's very sad.
And they are diverting all of these employees over, well, not the employees, the jobs over to the clinics, and they're doing this to bypass the union contracts that we fought so hard to get so that we can have fair treatment and equitable pay.
And let's be clear, we're talking about a hospital that is considered one of the wealthiest hospitals in the state of Connecticut that has currently over 200 days cash on hand. To give you some perspective on what that actually means, we represent hospitals that have 10 or 5 days cash on hand. So we're talking about a hospital that has the financial wherewithal to provide the level of care that's necessary for the people in our community.
If the corporation would stop the shell game and stop moving workers and services from one clinic to another doc in the box or whatever, and focus instead on patient care, that would be in the best interest of the whole community, and that's what the workforce wants to see the corporation do going forward.
We hear all the time about greedy corporations doing this, laying off people, outsourcing, shell companies, doing more with less. But it's really disappointing to see this community hospital that's supposed to be taking care of our loved ones, our mothers, our fathers, our grandparents, and treating people like this. It's absolutely disappointing and absolutely appalling.
If you go down to at the time, the LMPA office down the street, it actually had the L&M logo on it. And then once they realized that the gig was up and that the union was pursuing this charge 5 months ago, all of a sudden they rebranded it, changed the name, tried to demonstrate separation, tried to get separate legal counsel. But you know what? You can't put the toothpaste back in the tube. This thing's happened. They're one entity. I think they realize it as well, and they're in a jam, and they quite frankly, the right thing to do is to recognize the workers into the bargaining unit, and hopefully common heads will prevail, and through this process, that'll be realized.
And at the end of the day, what we hope this complaint, and as Lisa said, this indictment, provides is a real opportunity for L&M Corporation to turn the corner. There is a national trend that's taking place in managed healthcare across the country where not-for-profit institutions like L&M Hospital are behaving more like for-profit corporations. The National Labor Relations Board has said on these counts that is not okay, and it would be wise for L&M Corporation to recognize that and change course, and that's the message from each and every one of us who are gathered here today to L&M Corporation. Let's put patient care first, and let's make sure that the needs of the folks who live and work in this community are met, and the profits that Greg referred to that L&M has and will continue to make should not be put above the needs of those patients.